各位观众大家好，今天是12月7号，欢迎收看港湾 TV。 今天星期一，照例是按照前3天的周期给大家报数字。我们看一看，这个好像昨天有非官方的数字说是600多个，我今天早上在听那个 News 1130无线电，好像也是说到了昨天是600多还是700多，反正呢就没有更加变坏这个也是没有变 worst 也没有变 worse 希望这样能够平平淡淡。那么上个礼拜一和转播的时候呢，有记者问到，有媒体朋友问到说有没有会新的措施上去，因为现在看来这个新增数字没有减缓的迹象。Bonnie Henry 说一切都是看12月7号以后做决定，因为更严厉的措施就是原来限制在飞沙卫生局和延安卫生局的这些措施，2个礼拜之前是扩展到整个省，那么正好2个礼拜，上次说好是12月7号为周期，那么14天以后，今天他们会颁布新的，到底是更严厉还是往回走？目前来看，上星期三我们给大家做直播的时候， Bonnie Henry 说到了体育项目回到复工阶段的第2阶段，也因为我们现在是回复到我们现在叫复工第3阶段，那么体育很多项目全部回到复工第2阶段，也就是说面对面的碰撞以及人体接触的运动项目已经没有了，不允许有观众了。如果要从事一些健身类的体育，隔着网，比如说排球，还有排球，还有沙滩排球，还有像这种冰壶可能也行，反正就是说不要面对面人体接触的这一类。那么冰球好像不行了，只能训练了。同时呢，这个健身场所以及瑜伽，只要保证人员足够，空间不是很密闭，不是高密度的，应该还是可以，但是要严格遵守规范。同时卫生条例，卫生官员会对这些场所进一步检查。那么在关于人员聚集，就是家庭聚会方面，有一种传说，微信上说中英文的版本翻译不一样，中文的翻译不一样，有歧视。后来呢，他们也做了更新，说这个中文的翻译没有更新，其实就是允许，就是只要是6个人好，那么他们已经来了。
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, December the 7th. We are honored to be here on the territory of the Lekwungen-speaking people, the Songhees and the Esquimalt First Nations, and we're honored to be here on their territories. Tomorrow, Tuesday, we'll be providing a report, a written report with COVID-19 case numbers and other relevant information to the COVID-19 pandemic in British Columbia. And now, it's my honor to introduce Dr. Bonnie.
好，他没说礼拜3，应该礼拜3还是回到这儿来应该是这样今天因为有新的命令或者是模式，
Thank you very much and good afternoon.
盲人的翻译。
So today we're reporting our weekend numbers. So the first reporting period from Friday to Saturday, we had 647 additional COVID-19 cases in British Columbia. From Saturday to Sunday, 726 cases were diagnosed, and from Sunday to today, an additional 647 people were diagnosed with COVID-19. That brings our total for the last 3 days to 2,020 new cases, 10 of whom were epidemiologically linked, bringing our total in British Columbia to 38,152 people who've been diagnosed with COVID-19. That includes 304 people in the Vancouver Coastal Health Region, 1,362 people in the Fraser Health Region, 45 people in Vancouver Island Health Region, 203 people in the Interior Health Region, and 106 people in the Northern Health Region. We now have 9,380 active cases in the province in all health authorities, of whom 349 people are in hospital, 77 of whom are in critical care or ICU. We have 10,747 people under active public health monitoring, again, in all areas of the province, and 27,287 people have recovered from COVID-19. Over this past 3 days, we've had 35 people who have died from COVID-19, bringing the total number of people in British Columbia who've died from COVID-19 to 527. This, of course, brings sadness to us all, and my condolences go out to the families, to the care providers and communities of these people who passed away over the last 3 days. We know how challenging, how hard it is
349个住院这个是很重要的指标，就是看我们的医疗资源，其中77个在重症监护。
We have 6 new healthcare facilities in a variety of places around the province, including the Bradley Centre, Chilliwack Lifestyles, Crofton Manor, Lakeshore Care Centre, McKinney Place, and Village by the Station in Interior Health.
有些是长期护理院，有些是诊疗所。
At the Hawthorne Seniors Care Community, Lakeview Care Centre, Sunset Manor, Valley Haven Care Home, and Ridge Meadows Hospital. That leaves us with 57 active outbreaks in long-term care and assisted living and 8 in acute care units. There are now 1,697 active cases in long-term care, 1,073 residents, and 605 staff. Additionally, we've had one new community outbreak at a mink farm in the Fraser Health region. And of course, we are paying very close attention to this outbreak in other parts of the world, particularly most recently in Denmark, and prior to that in the Netherlands, and as well in the US. We've seen outbreaks on animal farms such as this, particularly mink farms, where there has been transmission from humans to mink and back, and where we've seen some
从人传到动物，动物又传对人，所以这个希望大家一定要注意，一定要大家遵照我们 WorkSafe BC 的行为之规范。所以我们的卫生这个文化厅长、文农业厅长都会给大家一些新的卫生安全指南颁布。我们也要采取额外的措施这个都他说看到了荷兰挪威都看到了动物农场这个爆发的情况，是人传给动物，动物又传回给人，这个是大家注意一下。所以他说我们现在从这个对动物来讲更加严格的卫生措施检疫。
Today as well, we have some very good news.
他说今天还有好的消息关键是疫苗。
As we all do our part now,
所以我们现在尽量都做我们的工作。我们现在全力以赴的在对疫苗的获取上，再来保护我们这些易受感染的人。第一批下星期就能够到了，是辉瑞制药的疫苗，第一批下星期就到我们省。这个是我们这个整个计划的刚刚开始虽然很少一部分这个主要是因为主要是物流的限制主要是给我们的长者长期护理院等等他们是太重要了，所以这个是先给他们。
And later this week, Dr. Ross Brown and myself and the Premier
那么这个礼拜周末，我们会还有另外2个医生给大家提供一些疫苗准备的情况我们如何获取疫苗，我们的团队如何管理，如何面对困难挑战能够获取，然后能够使得调整我们的计划，能够使得我们能够有效的快速的去拿到这些疫苗分发在我们省 BC 省。
I'm going to start today.
那么今天是他又拿了一个遥控器那么除了这个疫苗的这些令人鼓舞的那么这些消息以外，我们还要看到了这个高速的新的病例的增长。 这个特别是社区里边大家看到了这个又是一个新的模型分析，这个是每100万人口里边这个每1000人里边我们这个测试阳性比例。第一个是指每100万人里边有多少个案例，第二个是每测试1000人里边有多少个阳性比例。那么这个就是我们说的曲线啊。
And this is something that helps us understand how we're progressing over time.
这个是给大家看到了我们现在这个疫情的走势。看起来他看到这个曲线上去很急速上升的，他说 steep 就是这个陡峭。特别是最近几天我们慢慢看到了一个减缓的迹象说明我们过去2个礼拜做的措施已经开始产生效果了开始产生有效益了。这个所以我们每一天所做的就会产生不同的效果。所以希望大家能够继续不要掉以轻心。我们已经看到了这个新冠病毒在我们社区的传播。我们都看到了很多社区的爆发特别是在内陆地区北部地区看到了吗？内陆有203和106，这个也很多了。所以这个是让我们意识到我们现在的困难是很有挑战性的，很困难的面临的形势这个呢是飞沙看到了第一个是飞沙，第二个是内陆，第三个北部那么这个呢是7天平均医院的重症监护住院的情况，绿色的就是重症监护一个跳上去，然后呢又有一个尖现在又往下了。那么红他说是绿色的是每天7天里边的平均的看到了高峰的情况，这个是重症监护的然后那个不是那个不是说错了，不是重症监护就是那个阳性案例。然后呢他说这个住院和新增案例呢是有点滞后的。这个也是正常的。那么看到了住院的情况一直在上升，那么最下呢是重症监护的就是他说的是蓝色的就是 ICU 也是很重要的一个指标。所以现在是349个现在是那么现在看就是也是12月7号他说这个传播的趋势是怎么样，最近的趋势是怎么样。所以他说看到大家最近几个礼拜尽量的减少了室内的社交活动，所以特别是病毒传播，特别是在室内大家近距离接触的时候特别容易传染。所以我们希望能够有限制的我们这个社交的互动
Non-essential social interactions, so things outside
所以那些非必要的、非基本的工作的话呢，特别是工作场所和学校能够避免就避免。所以我们希望采取措施，能够往回走一走，pull back 就往回走了以后不要再往前走了。所以我们还要采取一些额外的措施。
And those conditions that lead to transmission,
所以我们现在看到了很多的那些拥挤的场所室内的场所等等导致了大规模的传染。所以我们现在还是要延续过去的指令命令所以就是延长了特别是对聚集性的，就是12月4号发布的就是大家不许访问了。一直到1月1号的午夜。
I am also extending my published order of December 4th.
那么现在看来了，它是 extending， 全是 extending， 就是现有的人员访问、人员聚集、社交，现在的命令继续持续没有更现在到1月8号了，就是说没有更严格，也没有更放松，所以这个那么还有很多是严禁的prohibit 就是禁止的。就是我们它会一个一个列出来，可能需要大家还要到 BCCDC 网站上去看。
Drive through and drive in to drop off
那么 drive in、drive through 这些都没问题，还有 drop off 就是大家是线上购物，然后去到drive 这个去取或者去放或者是这个pick up 都没问题curbside
As well, we are
pick up
accepting drive-in and stay events to a maximum of 50 cars.In which people must stay in their cars, and people attending these events.
还有就是50辆车的活动，但是这些聚集也是人必须待在汽车里边。那么可能就是指汽车里面吧。我们这么想，比如说大家实在忍不住了，大家要社交 ，OK， 你开车我开车，但是必须待在车里边了。
As a reminder, the other parts of the gatherings and events order that do not expire remain in effect for the foreseeable future, and that is the restrictions on adult team sports, indoor and outdoor,
特别是成年人的这些运动室内运动项目
some of these
包括这个健身
once we've issued the further orders and guidelines about how to do these safely in the new context that we are living in right now.As we have published last week, child and youth sport can continue with limited activities with specific restrictions and, of course, no travel for any teams in the province. As well, work-safe safety requirements that we outlined in the past weeks must continue, and these include reviewing and updating of COVID-19 safety plans in all workplaces, daily health checks,检视不断的审视我们的做些效果怎么样。我们几个星期前都提到过，我们也是在和 WorkSafe BC 一起，对，主要是低陆平原那些加强检疫检查那些工作场所的卫生检疫措施。我们接下来的本周末我们会继续谈继续关注这些地方。我们还会不断的检视他们这些工作场所的卫生检疫的措施计划。 I understand that for many of us, this will mean celebrating the coming important holidays
可能我们所有这些禁令对你们来讲，马上对一些庆祝的节假日给了一个不好的一个影响。但是我们没有办法，我们没办法了，我们没办法了。we can't， 我们只能这样我们有很多的方法，家谈之间可以联系起来，大家可以虚拟的联系。我们必须这样必须大家遵守这些卫生型命令。
As hard as this may be, let's remember that the
大家也知道可能比较困难但是我们一定记住我们所做的牺牲是值得的，这样能够保护我们的社区安全，保护我们的这个老年人然后使得我们的公卫系统的资源不要被击垮。大家可以看到刚才给大家的图表，我们已经做出了那么多牺牲了，我们不要再掉以轻心了。我们不希望看到这个病毒放任自流，我们已经看到疫苗已经要来了所以我们已经看到希望了。所以希望大家就待在本地，人员聚集少一点。接下来几个礼拜里边，大家再忍一忍，相互帮助如果减轻一些压力，大家肯定有压力这些老外没有社交会压力很大，所以他说相互帮忙 ease pressure 我们必须坚定这个战线能够把这个曲线拉下来。我也感谢大家的努力，希望大家每个人做好自己分内的事情。 使得每天做不同的希望我们采取不同的安全策略能够人员少一点能够在家就在家里这样的话都能够拯救生命，拯救我们的，保护我们的社区，保护我们的长期护理院。我们再也不像是过去一样前所未有的，希望大家团结起来，共同努力坚强，我们相互支持，相互帮助然后呢安心容忍，同时呢安全。谢谢大家。那么卫生厅长嘛又是做一个总结。
Thank you very much, Dr. Henry, and first of all, I want to start by expressing my condolences that at the premiere that of, I think, everyone in BC to the 35 people who passed away this weekend from COVID-19 in British Columbia. That was 17 from Friday to Saturday, 10 from Saturday to Sunday, 8 from Sunday to Monday. 23 of them lived in Fraser Health, and 2 in Interior Health, and 1 on Vancouver Island, and 9 in Vancouver Coastal Health. This is, and certainly given the orders that we're working under right now, the real challenges of those orders, a very difficult time to grieve, and we want everyone to know, all those families to know, all their friends, all their caregivers, that we see their loss and see their pain and are with them at this difficult time. I wanted to note that there are 349 people currently hospitalized with COVID-19 in British Columbia, 77 in critical care. And that is, of course, across health authorities, 193 in Fraser Health, 14 in Interior Health, 10 on Vancouver Island, 42 in Northern Health, and 89 in Vancouver Coastal Health. In terms of hospital capacities and occupancy rates at the moment, we consider this with 2 types of beds. One's our base bed, and also we add to that our surge bed capacity. So in Fraser Health, hospitals are occupied at 84.5% of base bed and 63.1% of total or grand total occupancy rate. In Interior Health, it's 89% of base bed and 70% when you add surge beds into the equation. In Northern Health, currently across Northern Health, it's 80.6% of base beds and 1.6%,
我记得上个礼拜他也给大家说到了这个问题，就是说现在的住院率的情况虽然上升但是控制在70-80%，还不是很严重，不是太严重只能这么说，也是自我安慰吧。
And 68.3% when surge beds are put into the equation. Now Vancouver Island is 81% of base bed occupancy rate and 74.4% of total occupancy. In critical care, those numbers are similar overall across the province. 78% in critical care in Fraser Health of base bed occupancy, and 43.9% of our grand total occupancy rate when surge beds are added into it. 74.7% in Interior Health, or 60.7% of total. 58.5% in Northern Health, or 37.5% of total. In Provincial Health Services Authority, 66.7% of base bed capacity, or 28.6% if we add surge capacity of critical care. In Vancouver Coastal Health, 86.1% of base bed critical care capacity and 58.9% of total. And on Vancouver Island, it's 51.5% of base bed capacity, and that is the same for the total. And so that gives you a sense of where we are in terms of beds. Of course, having 349 people hospitalized puts a very significant pressure on our hospitals and on our staff in those hospitals. It's not just an issue of beds, as we've said many times,
大家还不单单考虑到病床的问题，还要看到整个医疗的这个隔离这个检疫的问题等等。所以这个是都额外的，让大家额外的医护人员付出了额外的努力。因为这个礼拜他说开了7000个刀，很多都是这个紧急的非紧急的外科，这个也是额外的一些这个成就。
As you know, BC has ordered 2,241,600 doses
那么
of
又说到
influenza
了目
vaccine,
前的
with the
这
final
个流感疫
130,000
苗
doses expected
一
this
共准
month.
备了
This is a 47%
220万
increase in
个
the purchase from last year's
这
campaign.
个是已经比去年
2,109,107 doses
同样
of
的
flu
时期
vaccine
上
have
升
been
了
distributed by the BC
47%，
CDC
大家
to
都去
regional
打了
health authorities. And this number is a little behind schedule because it's based in part on billings, which are still to come in. But to date, at least 1,277,646 doses have been administered, with pharmacists administering 74%
那么
of
目前
those
为止
doses
他说已
today.
经
All
超过
residents in assisted
120
living
万的一
facilities
剂
and
的
almost
流
all,
感疫苗已
98%
经
in
被
long-term
打
care, have
被
had their
打了
flu-zone doses administered.
已经
Based
打到
on
了就
national and
是
provincial
这
surveillance,
个
all
医药技
indicators
师
of
他们
influenza
注册了
activity
打了
continue
注
to
册
remain
了，因为你
exceptionally
打一
low
针药剂
for
师
this
都要
time
去
of
注
year.
册一下。
Every Monday we
现在因为
update
都
you
是免
on
费打了
PPE sourcing.
那么现在他又给大
And
家
just
汇
wanted
报这个
you
PPE
they
的
have the
这
numbers in
个采
previous
购
weeks.
情况和
This
储备情
most
况。
recent week, last week, since our November 30th update, we had 75,801 N95 or equivalent respirators, 680,500 surgical or procedure masks, 184,656 pieces of eye protection, 87,904,000 pairs of gloves, and 1,738,000 gowns. BC has had PPE for healthcare workers when they need it, where they need it throughout the pandemic response. As you know, it was very challenging in the early days. Long-term care and assisted living providers, including private and independent ones, are provided access to BC's supply chain. This ensures safe and adequate supply when traditional PPE vendors are still not entirely meeting needs. Ensured supply for PPE for surgical renewal and increases in health services started in May when the surgical renewal plan was restarted. PPE is now being delivered to GPs, MPs, etc. in 3-month allocations, direct and free access through a portal to ensure safe provision of in-person care as required. And we've of course established dramatically increased warehouse space for PPE. And just to put this in context, we updated people in July as to the cost of PPE. And just to say what the pre-COVID pricing was, for example, for N95 respirators or equivalent, the average unit price pre-COVID was 62 cents. COVID peak pricing, which was in April to June, was $5 to $9.24 a piece. In July, it was down to $3.19 to $6.80 a piece. And the most recent market data has the average unit price from $1.50 to $9.25 a piece. So it was 6 to 10 times the original price in British Columbia. At that time, for surgical or procedure masks, we went from 15 cents, an average unit price pre-COVID pricing, to peak pricing between 46 cents per and to 125 per a piece. By July 2020, that was 20 cents to 65 cents a piece, and now it's approximately the same. In 2019-20, BC spent approximately $62.5 million on PPE. For 2020-2021, and obviously that year will end next March, we are forecasting spending over $400 million on PPE for the health system and stockpile. And finally, just make one further note, and this is connected to the ongoing work that Dr. Henry, the Premier, that I, and many other people have done with faith communities. I want to announce that we've retained Robert Dahm, a well-known and deeply respected Jewish scholar and facilitator, to conduct a series of discussions with faith leaders. I'll participate as available to assist in this very challenging period for faith communities and for them to inform us in our efforts. We very much appreciate Mr. Don's participation, and we look forward to people across faiths and across denominations to take part in this effort. As Dr. Henry has said, the orders are being significantly extended to well into January, to January the 8th.
那么卫生厅长的话呢，我没有怎么去给大家说。第一个呢是数字比较枯燥，第二个呢，他也是重复了，因为政客嘛，他也是重复了这个刚才Bonnie Henry 的话他也说到了Bonnie Henry 颁布的卫生命令，有些呢是到1月2号，有些到1月6号我觉得没有什么大的区别，但是他也是说到了所有的这些命令都涵盖了今年的圣诞节和元旦，大家肯定要付出很多的牺牲，这个请大家也继续 能够保持、能够理解每个人的牺牲都是值得的那么今天的其实从 Bonnie Henry 的话来讲我们省下个礼拜开始可以打疫苗了。
New and special memories, and even perhaps build some
当然了，这
new
个是
traditions.
象征意义多一点。大家都知道，疫苗现在是全球最紧张的。BC 省能够拿到，哪怕实际也是说是有意义的啊。我们本省开始打疫苗了。
Religious or otherwise, and they'll keep us safe too. This year, letting down over the holidays and using the skills we've been taught to stop the spread, and pulling back from following the guidance we've been given to save lives. Will create a COVID debt in December and a daily case number bill that will come due in January at a cost we simply cannot afford. This year we must spread good cheer without spreading COVID-19. This year, home for the holidays means staying home for the holidays to stop the spread and keep everyone safe. This year, no matter how we
所以他也是说到了，就算是有很多的节假日，但是也是要保证每个人的安全。希望大家每个人的行为也是我们每个人所必须的。然后呢 ，foundation 就是大家每一个最基本的这些东西具有深远意义的然后呢，那么不是所有的观众都是一开始看我们的直播，我再给大家汇报一下过去3天的新增的数字。周五到周六647，周六到周日726，同时周日到周一又是647，3天2020，这么巧，这个数字2020。那么总数呢是38152，这个现在住院的情况呢是349个人住院，其中77个在 ICU 重症监护。那么过去3天里边死亡35个。那么现在媒体提问的时间。
Thank you, Minister. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to one question and one follow-up only. I would also ask that you please take your phones off mute. You will not be audible until your name is called. First question today is from Marcella Bernardo, News 1130.
Bonnie Henry 听听这些名字，他也都笑了。反正每次问来问去就这些人，可能都没见过。这个是来自 News 1130无线电的那个。那么他说到了学校的暴露情况。有什么情况？就是说你们什么原因暴露的情况老是滞后。他说这个暴露的情况我们表明了，始终表明了这个社区的感染情况我们社区的感染力还很低，特别是这个学校我们学校的爆发情况很少所以现在看来学校的还是重要的安全的情况对我们的教育员工对孩子们来讲都是重要的
whether there was a rationale for closing schools early, extending breaks, and
那么他说大家讨论的这些都是合理的包括早点放学，就是延长假期等等我们都会看到了各种这样的好处和坏处。那么，但是呢，学校的互动还是很重要的教育的互动。那么现在是有一种传说，他们在考虑寒假再多延长1个礼拜、2个礼拜。那么现在还没有消息，我们要坐等了。
The Federation of Associations for Counseling and Therapists, they want the reform to fall in line that you've ordered over the summer. They want that to fall in line with other regulatory reforms. So what are your thoughts on implementing this and hopes of expediting this process?
Well, as you know, in the past year, we've been involved in a major reform of health professional colleges in BC. One of the outcomes of that reform is the reduction of the number of colleges, a significant reduction of that number, and the raising of the standard of regulation. Those reforms, which were, as you'll recall, developed by myself on a committee and unanimous report with the then Liberal health critic Noam Letnick and then Green Party health critic Sonia Furstenau will do just that. they'll also make it easier over time for new professions to potentially become regulated should they meet the standard. And so I understand that this is a day of advocacy for people who support the efforts of FACT-BC, and that they've been advocating for some time. There are other professions in those circumstances, and we'll be working with those professions as well. It's our expectation, working together with all parties in the legislature, that the very significant reforms, I think the most significant reforms ever done of health professional colleges in Canada, will be put in place in the spring, and the positive effects for the public in terms of transparency, raising of standards, and a reduction in the overall number of colleges will have a very positive effect, including for professions who are seeking right now professional recognition.
Next question is from Shannon Patterson, CTV.
Oh, hi, Dr. Henry. Just confirming, you are saying no Christmas dinner with anyone outside of your household, no eating at restaurants.
那么这位 CTV 的记者问，请他澄清一下，这个圣诞餐没有任何人可以一起吃饭，是不是这样的吗？除了家里边的成员以外。
Will be on board with basically being locked down for Christmas?
This is not a lockdown, clearly.
他说这个不是 lockdown 不是封城，这样说的。
And it's making a difference.
我们今年不一样，今年的圣诞节不一样。
For our families,
希望大家就是我们只要的，希望为我们家庭考虑我们的公卫系统这个困难很大，挑战性很大。我也知道大家期待着能够其他的服务行业等等能够开放一些。这个社交的活动比如说家庭之间的走访或者是聚集或者大家吃一顿圣诞大餐希望大家不要这么做了，大家就遥远做一做今年的假期是不一样的，好不好？我们希望大家清楚，我们省不是单单我们省这么做，其他的人都这样我全球都是在面对病毒在做斗争。所以我们现在知道最好的办法就是减少聚集。大家不要抱有侥幸心理10个人差不多没问题这个是始终提醒大家，你今天是10个人，他又是10个人，都是指数级的10乘10、10乘10这样上去了。所以这个我们已经知道，这个病毒的传播就是这么，特别是节假日期的传播特别容易。所以这个没有额外了，没有侥幸心理。所以今天看到了，就是说圣诞大餐也是家庭为单位。那么这位记者问的是今天听到的疫苗的好消息，那么我想跟一下这个哪些是先打。他说我已经被问到很多这些问题了。那么我今天有一个好的主意，但是我们还要观察看看。
Exactly where they'll go. Understand, though, the first vaccine that we'll be receiving is the Pfizer vaccine, which means it has to be kept at -80. So there are limited places that we have the equipment and the ability to do that. So we will be receiving small amounts to start with across the country, and we will be focusing on those most at risk. And for us in British Columbia, that is people, particularly healthcare workers who are working in long-term care and on the front lines in our health system, in emergency departments, ICU, medical departments. But we will be providing more detail about what we see rolling out not just next week, but in the coming weeks and months, and where people may find themselves in the rollout of vaccine. So this is the beginning. We're putting all the details together, and later this week, with the Premier and Dr. Ross Brown, will be having a more detailed briefing for everybody, for the public and for you, and we'll have a lot more details by then. I will tell you as well that we're participating this week, starting part of it has started already, but starting tomorrow as well, in a trial run of receiving the really specialized containers that come from Pfizer. They won't have vaccine in them at this point, but they will have the dry ice, and we'll be going through all of the procedures that are needed to safely handle these very fragile vaccines. So it's exciting. We're expecting that Canada will come up with what we call a notice of compliance in Canada, which is a license for the vaccine to be used, and we'll be ready to put immunization into people's arms as soon as we can. We are not going to have enough in the first few months that it's going to make a difference in community transmission. So that's why we all have to be continuing to follow our COVID safety plans. But we will be able to protect those people who are more likely to end up in hospital, who are more likely to die from this virus, and also to protect our healthcare system by ensuring that people who are at risk in our healthcare system are protected too. So that'll be the focus to start with, and that's why it's such a challenge for us now, but that light at the end of the tunnel is there, and we need to do our piece to keep our rates low so that we prevent people from dying until we have this protection for them here in our communities and across the province.
能够保护我们的家人整个省都这样，不要觉得疫苗来了，我可以掉以轻心了。
Thank you. I know BC is working on starting a pilot this week in long-term care with the rapid tests. I'm wondering how quickly you think you will be able to make a decision on whether this would be
那么他说这个礼拜呢是一个试验阶段，对长青护理院有一个快速测试的试验阶段这个 pilot 就是试用期试样，我们打火炉上有一个 pilot 就是这个意思，就是临时性的那么他也是说解释一下
So what we need to do is understand, one, if it's feasible, because one of the challenges we have in care homes is human resources and the stretched human resources, but also how does it fit into the screening that we do of people, of healthcare workers every time they come to work, and where does it play a role in helping us in that setting? We have, as I've reported on before, been using the rapid tests in other settings where we know it can be of benefit, particularly remote communities and in some of our shelters and our advanced surveillance in, for example, the downtown east side in Vancouver. And there's been challenges with the tests themselves. They don't actually work that well in the environment in the cold. So we're learning about where they might fit in. And yes, there's a number of long-term care homes in the Lower Mainland where we'll be starting to look at feasibility and whether there are value in that setting.
以及这些没有固定场所的这些人的身上。
Yes, thank you. You said earlier today there was almost, I think, 1,700 active cases in long-term care homes, and I'm not sure. Maybe you can clarify how many long-term care homes have new outbreaks. You said 6 facilities.
那么这个也是关于这个长期护理院的爆发情况。
What does that say about what's wrong with the current screening protocols? Because clearly they're not enough.
Yeah, you know, this is the question. We can't intuit where this virus is, and the screening we are stepping up, of course, as everybody is, but we also have close to 60,000 people who work in long-term care, and everybody goes to work every day with the intent of doing their best to take care of people, and nobody intends to bring the virus in with them. It is so challenging this time of year when the virus is spreading so rapidly, and we're seeing that around the world and around the country. So yes, screening is a huge part of it, making sure that people are able to stay away if they're not feeling well, making sure we're able to test people rapidly, and we have a good response to that now. But despite our best efforts, yes, the virus does get in, and that's where we need to make sure that we're trying to detect it as quickly as possible, and it's becoming more and more challenging challenging. And this time of year, we've seen this not just in care homes, but in other communal living settings, in farms, in workplaces, in the measures that we've put in place for gyms and settings where we could do things even a few weeks ago or months ago. The virus is transmitting very easily, and sometimes we don't recognize it. So we are looking at everything that we can do to try and protect care homes. And this is where vaccine is going to be so helpful, because we're able to protect those people who are working in care homes to start with, and residents themselves. And that is the focus of the first few months and weeks of the vaccine program.
就是卫生检疫卫生措施都是一回事，人的遵守不遵守又是另外一回事了。那么他说这个周末的情况就是教堂的聚集，有些人呢宁可付钱付罚款都要让大家到教会聚会这个问题是比较严重。周六的时候有当堂有反戴口罩的人群聚集，礼拜天包括美国包括当堂都有传出来有些教会违反禁令，还是在这个宗教的聚集。他说这个我们的这个卫生卫指南里边都有这个罚款的细节。
it is a challenge, and
对我们来讲，他说对大家来讲都是挑战特别是对这些这个宗教团体来说，我也是关心他们，我也是担心他们，他们没有对我们的这些限制措施完全遵守。我们已经看到了这个，如果人员在大规模的在室内聚集的话，那么这个传播会很快不管你们在采取什么措施都没有用。
We are now seeing that those are not enough right now.
我们已经看到了很多了这些传播的案例。
But I want to turn it around and talk about the vast majority of churches, synagogues,
包括了synagogue， 我给大家说一下，就是犹太人的教会、教堂所以 church 我们天主教、基督教都是希望大家都能够遵守我们的卫生命令。这个是很重要的，越来越重要的因为马上都要过节了，圣诞节就是一个宗教节日希望大家能够安全的这个行为去做。我们也跟这些宗教领袖跟人见面跟他们交谈。我们都看到全世界其他的宗教领袖都得到了同样的信息这个全球流行病，这个表示我们全球没有一个地方是额外可以做的我们一定要保护我们的社区团员的安全。我们知道这个是很有风险的，你们怎么做我们希望大家往回走一走希望大家相互能够保护大家。那么包括了这个礼拜六的这个抗议戴口罩的游行他说也是要回答这个问题他也说这个也是增加了传播的风险
caring for people with COVID, making sure that people are still getting their surgeries. It really, in some ways, is a slap in the face. And we also need, however, as I've said all along, to recognize that people have a right to peaceful demonstration, and that as long as it's outside and they're not putting others at risk, the risk of transmission of the virus is less. Although, as we know, this time of year, it is more dangerous than it was before. So I don't condone them, and I think
我不能去责备他们，但是希望大家能够做出正确的事所以我一直在说亨利医生呢是比较左倾的，也就是说比较民主、自由、隐私 这个是亨利医生很明显在他身上，也就是反川普的。我这么去乱理解了啊，当然这个是我个人的说话，我不代表任何人。我就说一下，因为我们不知道他的政治倾向，但是从他的这些话，从他的制定的政策来看，基本上还是左倾的一个这个倾向。
Is that an unintended consequence of the measure around adult sport? And can you explain sort of why to make that decision that could have impacts on these sort of leagues?
It was not unintended. It was a recognized risk, and we talked with Via Sport, we talked with the leagues, and really it is about the fact that these leagues travel, that we're seeing transmission, and we're seeing transmission in US and other sports teams as well. So we have been seeing transmission events happening, and right now it's just too risky. We don't want people traveling to interprovincially. We don't want people traveling to different communities, and so yes, the intent was to reduce that risk right now and to have an extended break for the teams. And I know in many cases, I've heard in discussions with the league as well, it's about young people returning to their home communities and having a time with their families during this period. We know that around the country and around the globe, the competitive leagues have had a challenge this year, and everybody is having these challenges. So it is an unfortunate thing in some ways, but it's also the most important thing that we can do right now to make sure that we're protecting youth for the future.
We have time for one more question. For everyone listening today, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For up-to-date information about the province's restrictions, visit gov.bc.ca/regional restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question is from Marc-Antoine Boulanger, CBC Radio Canada.
Hi, Dr. Henry. Can you elaborate a bit on why you decided to extend the orders all the way until January 8th rather than just going ahead into another 2 weeks chunk? Were you perhaps concerned about people that would make Christmas plans? And maybe people that were also hoping the restrictions would be lifted. And that, so
谢谢有一位网友对我的鼓励，谢谢你，谢谢你，你的英文更好，你不用谦虚。
Sure.
我只是
yes, it was partly
解
that.
说
So we've
所
had
以
a
我
lot
是
of
解说。
discussions over the last 10 days, but particularly over the last few days with a number
他
of
说我们
colleagues in
团队
particular in
的
public
同
health,
事在过去10天都在
across
讨
a
论这个
number
问
of
题。
different sectors. And really looking at where we've been with our curve, what is happening, where we're seeing transmission still, where we're seeing transmission still on the upswing, and understanding where the transmission events are happening. We recognize that we are seeing an impact of the orders, but it's not yet at a point where we can let off on some of the restrictions that we have in place. And very much, the next incubation period would take us to just a few days before the Christmas holiday.
所以他说，现在如果再命令的话，也就是2礼拜，也是圣诞节前几天就结束了。那么这样的话，圣诞节大家又来这个我们这个是最难受的地方，所以我们就是要包括了接下来的新年，所以我们还是要禁止大家家庭聚会包括这个圣诞活庆祝活动等等包括新年的活动等等，我们还是觉得这个要禁止，所以就是我们也看到了疫苗已经来了，我们也看到了这个新的案例在下降但我们不能再接着起折腾了，我们经不起真的，我们再没有办法再付出这个沉重的代价包括我们的这个测试的容量的趋紧包括我们的这个医疗资源的这个用紧，所以我们所有的这些因素考虑，所以希望我们能够度过这个安全，所以我们考虑到把现在的这个命令禁令延长到1月8号。 我们看到吗？这个 Bonnie Henry 对我们的卫生厅厅长不怎么他们可能不是上下级关系，因为没有行政的关系，看上去不像我们这个中国的官员底层的看到上层的那种毕恭毕敬的，他好像没有这种感觉所以我就说这个亨利医生比较左倾一点。
At doors and say, hey, you're not allowed to gather. And then if
这个记者看上去是法语的记者这个听得出来他的英文
So the intent of the orders, as we've talked about for the last few weeks, is to reduce those social gatherings because we know that's where the virus has been transmitted. And the vast majority of people understand that, and it makes it very clear. It means that I can say without qualms, no, I'm sorry, I can't come. There are some people that don't understand it. People in my life who maybe don't quite get it. So it is partly about making it okay to not have people over this year, to say let's try something different, let's try to support each other in a way that doesn't have those expectations of us having to come together, us not having, but us coming together in a way that could put people at risk. So yes, you can say no to the party this year. You must say no to the party. You can say no to travel, say no to having gatherings with people outside your household. And that is really important. And yes, we have had people fined who have had parties who have disobeyed this. But that is a deterrent that is only there to make sure that when people are being egregious, we have a way to address it. Because I think the vast majority of people in British Columbia who I hear from, who I talk to, understand that this is a most challenging and year that we've ever experienced, at least in my lifetime, and hopefully will ever be in my lifetime, and that we have to adapt, we have to be resilient, and we have to support each other with compassion, especially now.
我们一定要现在就要行动起来。那么可能叫卫生厅长用法语来回答了。那么果然好，那么我再说一遍，这个过去
Dr. Bonnie Henry and Health Minister Adrian Dix wrapping up BC's pandemic update for today, and we have learned the current restrictions have been extended. 22,020 new cases and 35
2020年今年正好是2020那么这个我们也不希望这个是巧合我把这个关一下我再给大家报一下数字在过去的3天礼拜5到礼拜6是647，礼拜6到礼拜天726，礼拜天到礼拜1 647， 3天加起来2020，那么总数到了38,152，其中延安卫生局是304，飞沙卫生局是1362，岛上卫生局是45例，内陆卫生局是203例，北部卫生局是106例。很遗憾，过去的3天又是死亡35例，那么累计总数到了527例了。住院的情况呢是349个住院，其中77个在重症监护。好了，各位观众，那么今天是礼拜1，现在他们没有说礼拜3，但我估计礼拜3会有，所以请大家还是持续关注我们的频道。感谢大家收看我们港湾 TV， 感谢大家对我的鼓舞和支持，也谢谢你们希望大家都 stay health stay safe。 那么我们今天就到这儿，我们下期再会。